So it would be helpful, because you're going to do 3 breakouts today, it would be helpful to reduce the time for introductions, because these are going to be fairly tight timelines. If you would be willing to put behind your name, now this isn't for the fellows. I have some more instructions for them, but if you're a participant, you're not in this year's class, if you would put behind your name your institution or an abbreviation of your institution. So something similar to what I've done. I have AAL after my name. And if you are in this year's class of the ADEA Leadership Institute, we'd like for you to do one more thing. In addition to putting an abbreviation of your institution after your name, put the scenario number, the scenario in which you worked, put that number in front of your name. Again, just following my example here. So we have 89 people here. I think I'll go ahead with some other, just some basic housekeeping announcements. Please stay muted during our main session. We're large enough that I don't think we'll be able to unmute without talking over each other, but please feel free to use the chat. A number of you have already used the chat to do some troubleshooting regarding the logon. We're going to take a break. That break's probably going to be around 2 o'clock, depending on how things work out in the flow of the session, but we'll take about a 10-minute break somewhere near 2. We have a couple of handouts. Felicia, I think, has sent a link to one of the handouts if you have not received that yet. That handout explains something about scenario planning, and it includes highlights, 1-pagers of each of the 5 scenarios you're going to be discussing today. A copy of the slides. So I'll be using a slide deck. You'll get those slides at the very end. I think that pretty much covers the housekeeping details. Felicia, can you think of anything else?
No, I think you've covered it all, but definitely please stay muted and where possible. And as well as if there are any issues, don't hesitate to let us know in the chat and we will resolve them as quickly as possible.
Great, thank you. All right, so if you don't know how to change your name, go up, put your cursor over your picture. In the top right corner, there are 3 dots. Click that, and you're going to have a drop-down menu, and one of the options, name. Okay. Well, look, let's go ahead and get started. I'm going to share some slides with you. Again, I want to welcome you. I'm Carl Hayden, and welcome you to the ADEA Leadership Institute Symposium. This is the first time, obviously, we've done a virtual symposium. This is the first time we've done a project like this in the Leadership Institute. So our symposium is on the future of dental education, a scenario exploration. So I put this slide together just to say, wow, what a 12 months we have had, right? It is unbelievable what has happened since, almost an anniversary of this day, over the last 12 months. Who would have thought that we would have an empty classroom like this, where the professors actually lecturing online? Who would have thought that we would have had the issues around racism that we've had in our country over the last 12 months? And of course, the impact of the pandemic. All of these things led us to come to a different type of project this year for the Leadership Institute. Many of you are alums, many of you also know about the Institute. So you know that each year, in addition to the formal curriculum, there's also a project that peer groups work on over the year. So we started a little late this year. We started, the orientation was May 1, but during April and May, and when I say we, I'm talking about President West, Dr. West at at ADEA, Felicia and I and some others are talking about what would make for an project this year, given the place that we're all in, given the place that dental education is in. And so that's when we hit upon developing scenarios. So developing scenarios and thinking about what's happening right now in the environment and how is that going to impact dental education in the future. Sorry, I seem to have a delay with my slides. There we go. So here's what I hope we can accomplish in the next little less than 3 hours now. Creating scenario plans. I'm gonna explain to you how the class this year developed their scenarios, and explaining that process. This is a process that anyone could follow if you wanted to create scenarios at your institutions. We're going to look at different futures of dental education. Our time frame is 5 years. So we're looking out to roughly 2026. And then when I say apply scenario planning to decision making in academic dental institutions, in your breakouts, you're going to have a couple of discussion questions. And those discussion questions are about what do you do with these scenarios if they were to occur? So what are the threats? What are the opportunities? What are ways that you can make decisions and take actions that will either help you realize or actualize one of these futures or avoid it? So here's a definition of scenario planning. If you have the handout, you've seen something similar to this. We're creating visions or realities of the future. And these are generated by what we call critical uncertainties or change drivers. We're going to explain that, and I'll show you how we did this in just a moment. We put ourselves, as you think about realities of the future, we tried to put ourselves in 2026 and write these scenarios from like we were standing in the year 2026 at an academic dental institution. There are great reasons for scenario planning. It's anticipating and preparing for the future. The idea of looking for key indicators. I mean, you think about these key indicators as milestones, and if you're passing some of these milestones, it should indicate that you're headed toward one of these futures, perhaps. And then I think maybe the most important aspect of scenario planning is so you can create the future that you wish to actualize. So you envision a future and make decisions to move toward that desirable or ideal future. So think about where we were last year at this time. Right now, we did miss the annual session last year. We weren't together last year. But who would have thought? I mean, like last year, if someone had said to you, 500,000 people in the United States alone will die of this virus. We knew about the virus. We had no idea of the potential impact. Or if they told you we would no longer be able to have on-site classes. There are lots of what ifs, right? I mean, if you told me 12 months ago that I'd put on a pair of shorts, a coat and a tie and have the ADEA Leadership Institute Symposium sitting in my basement, I would have never believed that. Think about wearing a mask. All these things we just never anticipated. And you know, this last point, who would have thought that in record speed we would develop vaccines, 3 vaccines now to combat this virus. So who would have thought that a year ago? So one of the things that the Leadership Institute class did this year is they did some what ifs, and they did these what ifs looking to the future. So this pandemic will eventually get behind us. So what if the economy roars back after the pandemic? I know people, I'm probably speaking to people that can't wait to get back on an airplane and go somewhere and travel. So what happens if the economy roars back? What could that mean for education? What happens if the economy falters? And what's that impact? This idea of technology and new perspectives around educational innovation. So I had a conversation, this was in the summer of 2020, with a medical school dean. And he said, you know, we've been talking about doing something like a hybrid model for a long time. And every time it come up, the assumption was this will take 2 or 3 years for us to engage in any type of meaningful hybrid delivery of the curriculum. And he said, you know, we actually turned this around in about 3 weeks. And he said, we're doing it pretty well. So what if we actually take these new perspectives and the new application of technology and emerging technology and really change the way we educate? Or the alternative to that is, what if we go back to the way things were? And then this last bullet point, this is one we should all be thinking about. What if there's another pandemic? What do we do? So as you think about constructing scenarios, this would be, I would say, the first important slide as you're thinking about your own model. You want to construct scenarios. Where you want to focus your scenarios, what you want to consider is what's really important and highly uncertain. These are the key drivers that are likely to have an impact that you need to anticipate. What's unimportant and uncertain, or even if they're certain, if it's unimportant, that's not the place to focus. Neither is what's predictable. You're primarily focusing on the uncertainties and critical uncertainties. The intersection of two uncertainties creates your model for scenarios. Now I'm going to explain how we did this, but to just keep this image in mind. These are two uncertainties. Right now, you name whatever comes to your mind. There's an intersection, and at this intersection, or because of this intersection, we're able to create 4 different scenarios. So this is what the Leadership Institute Fellows did in terms of process to get to where they are today. The first thing that they did, which will be familiar to you if you're an alum of the Leadership Institute, is they did an environmental scan. Now, that environmental scan involved a literature review, and I have literature review in quotation marks here because this wasn't like a literature review of peer-reviewed manuscripts. This was just looking at mostly what was in the popular press last summer about what was happening because of the pandemic. So we were looking at the impact on educational models, a lot of concern about finances. So we were just reading what people were thinking, experiencing, and predicting for the future based on what they were going through in the summer. And then they did interviews. Again, if you've been in the Institute, you know those interviews involve senior leaders at parent institutions, as well as leaders in organized dentistry. So this environmental scan informed their next step, which was a SWOT analysis. We did what I call a 4x4 SWOT analysis. Most people are familiar with SWOTs when they do strategic planning, for example. You look at strengths and weaknesses within an institution, or in our case, we were looking at dental education and looking at opportunities and threats, which typically come from the external. But we did it a little different. We used the Bowman and Deal model. Most years in the Leadership Institute, we've read one or more of the books related to reframing. And we assess strengths, weaknesses, opportunities, and threats in each of these 4 areas. So structure, just how is the institution, how is dental education structured, human resource issues within dental education, political issues, so power, resources, how are they affected across this SWOT analysis, and then symbolic, how is dental education seen, how is it positioned within the parent institution, for example. So these were our 2 basic steps, and these 2 basic steps led to the identification of first some strategic questions, and then from these strategic questions, some priority areas. And if you'll look to the right of this slide, you'll see the priority areas that emerged from the SWOT analysis and the environmental scan. So we looked at these and we were thinking, okay, now, can we use these in terms of some change drivers that would help us develop our scenarios? And based on feedback from across the class, and that feedback, again, I should say, was informed by interviews as well as the literature review that the fellows did, we came up with two. Finances or economics and educational innovation, with the thought that these two are probably the most critical change drivers among these strategic priority areas. So that's where our intersection takes place. And I'll show you that in another slide or two. So in terms of the entire scenarios, if you look at item 5 here, or step 5, the scenarios that the fellows have created include something that we call a day in the life, and that's a case study. So that's, you'll meet a character or characters in the future and what they're experiencing 5 years from now. Highlights, and the highlights are those one-pagers that you received as a handout for this session. And then details. The details are an expansion of the highlights. So a lot more information about what's going on within that scenario. And then step 6 here is gathering stakeholder feedback. And that's what we're doing today. We want the session to be a conversation about these scenarios, not whether they're right or wrong. I'll ask you about what you think the probabilities are. But a discussion about these scenarios, and in particular, how we create the future, in some cases to avoid a scenario, and others maybe to realize some of the best aspects of these scenarios. So I said we looked at two change drivers. Here they are: educational innovation and financial sustainability. Think of these as lying across a continuum. If you look at educational innovation, for example, on one end of the continuum, we've got traditional with minor changes, the other progressive and innovative. Financial sustainability, a weakened financial position juxtaposed to a strengthened financial position. So when the fellows started looking at these drivers and thinking of them in terms of a continuum, just for example, we look like at educational innovation. So what would traditional with minor changes actually look like? What would progressive and innovative look like? And I'm not going to read all of these to you, but I'll just highlight a couple. So, traditional would be sticking with a 4-year curriculum. Progressive and innovative might be something that you could call truly competency-based curriculum. So if it takes somebody 2 years to get their DDS or DMD, great. If it takes them 6 years, that's okay too. It's truly competency-based. That would be a difference in a traditional and an innovative model. Or little to no sharing of faculty. So that's sort of where we are now. To, maybe in 5 years, there's a common core for all dental schools. So these were just possibilities. These are like brainstorming what's on each end of these continuums. So this is where we ended up in terms of our intersection of the two change drivers. Now, this model is very important for you to keep in mind. It's in the handout, but it's very important for you to keep in mind as we're talking about the scenarios. So if you will look, and I'm hoping you can see my cursor, but if you look at financial sustainability, on one end of the continuum, we've got the strengthened financial position. On the other end, we've got a weakened financial position. So from 12 o'clock strengthened to 6 o'clock weakened. The educational innovation, again, traditional, that's at 9 o'clock, and then 3 o'clock progressive and innovative. And each one of these scenarios is based on the intersection. So scenario 1, for example, is a scenario where dental education has a strengthened financial position, but is still traditional in terms of its approach to dental education. or just by example, scenario three. Scenario three, maybe that's where everybody wants to be. That's a strengthened financial position for dental education, and also being very progressive related to the approach to dental education. So we actually have a fifth scenario, and you might ask, so, how does that fit into the model? Because the intersection of the change drivers creates 4 scenarios. Well, one of the things that I didn't say early on, or that I alluded to it, the pandemic certainly informed all 4 of the scenarios that you see at the intersection of the change drivers. But another really obvious question, I think, for dental education is, what if it happens again? So what if there is another pandemic? And that's why we developed scenario 5. If we had a fifth peer group, it made sense to ask this question and to entertain it as a part of the overall scenario planning. So one of the last things I'll mention before we move into your hearing about the scenarios more and the breakouts is we didn't lose the strategic priorities. We're actually still working on this table. But one of the things that we did, we pulled out finances or economics and educational innovation from among the strategic priorities as change drivers. But we recognized that these other areas are critically important as well. So as we've gone through this, we've asked, so let's just take one, for example, interprofessional education and collaborative practice. How would scenario 1 affect IPE and collaborative practice? Or how would scenario 2 affect diversity, equity, and inclusion? So all of these we didn't want to lose anything in terms of these priority areas and how they might be impacted or how they might look 5 years into the future based on the scenarios. So I'm going to turn to our steering committee next. And I first, before doing that, just simply want to thank them. I have them listed here in the order that they're going to present to you. But each one of the 5 peer groups identified a person to serve on a steering committee. And the steering committee has sort of been the planning committee I've been interacting with, Felicia and I've been interacting with since the fall. And they've done extra duty to help develop the scenarios. And this, as I mentioned before, this is the first time the Leadership Institute has ever done anything like this in terms of scenario planning. So frankly, there have been things to figure out. And the steering committee has been great in helping me figure out things. Even I think last night at 10:30, we were still exchanging some emails about our session today. So I'm grateful to them, and I'm going to now turn it to them. Dr. Karen Quick, I'm going to ask you to unmute, and just so everyone knows, I am controlling the slides. So our steering committee members are going to tell me when they want to advance. So Dr. Quick.
Great. Thank you, Carl. So you can advance to the next slide now with that. And so our scenario, the more things stay the same, the less they change, involves a continuation of the traditional dental education model with some minor changes supported by a strengthened financial position. Let me introduce our team, beginning with Dr. Clark Stanford from the University of Illinois, Chicago. The E-innovators are Theodora Donchu, Mojda Deghan, Lance Godley, Zhuja Horvat, Faizan Kabani, and of course, me. So our scenario embodies that space where there's effort, resistance, as well as a tendency and some motivation to promote change and innovation. 3 highlights from our scenario are that increased funding for research by 2026 lacked broad application and advanced only at research-intensive institutions over the long term. Attention to equity issues, including diversity, inclusion, and belonging, led to community engagement that looked good on the surface, yet commitment to these initiatives waned over time. And traditional academic culture ultimately swallowed up much of the innovations and advances in teaching, research and scholarship, and service that began with gusto with the Great Awakening of 2021. So how could this happen? Our team worked out our scenario as we did this. We noted a number of examples of funded innovations that get started with enthusiasm but are not sustained. We thought of cases where there had been significant investment in physical infrastructure and or facilities and then fell into disuse versus evolving dynamically over time. Additionally, we considered traditional academic structure and the culture it feeds that is more commonly hierarchical, competitive, and rewarding of individual achievement over collaboration and team efforts, and how that traditional structure is often at odds with innovation and progress, and how it can be entrenched despite best efforts at change. In our quadrant, we see many opportunities lost. I'm now going to turn the floor over to my colleague, Dr. Marco Buttino. So Marco, take it away.
Thank you. So good afternoon, everyone, and thank you all for being here. So our scenario is scenario number 4. Thanks, Carl. Next. And as we can see here in this chart with all the different scenario models and the 2 identified change drivers, educational model and innovate and financial sustainability. So in our case, we explore changes and report to 2026 in a highly innovative, progressive and innovative mindset, but with under-resourced, so in a weakened financial sustainability. So as our highlights, I'll draw your attention to 3 particular aspects in our scenario, or actually before that, I'm going to introduce our group. Sorry about that. So we are the Confident 20, and our Dean, Dr. Sheree Farmer-Dixon, served as our advisor through the last year. So besides myself, we have Bridget Ferguson, Natalia Garcia, Susie Galsby, Anna Carolina Botta, and Paul Subar. So now to the highlights of our scenario. So 3 key aspects. We really devoted quite a lot of time to try and connect through the identified change drivers. So the way that we deliver education. So in our assessment, in our predictions, so this evolved rapidly in the last few years, with an increase in the number of remote sessions and remote delivery of education, which in turn has certainly amplified the interaction among students and their professors. Another important key aspect that I think over the last decade at least, we have worked tirelessly to try and make this a reality. So the change in the healthcare system, the way that it's focused from disease management to disease prevention and health promotion. So this has been leveraged to the greatest extent, and IPE and IPC education and collaboration within medical professions has been now consolidated. In terms of scientific and research scholarship, has also greatly increased after the pandemic. So keeping in mind that we are under-resourced but very progressive, there is a lot of collaboration, both nationally and internationally. So focusing the collaborative efforts that have resulted in innovative discoveries and cost-saving solutions to problems in oral health care. Very interestingly also, the assessment based on the events and the great partnership between pharmaceutical industry, pharmaceutical companies, NIH, NIDCR, and trying to tackle the problems that the pandemic have impacted, Also, we can foresee, or the way that we predicted, we can foresee research funds being dispersed or being out there on a competitive basis to drive scientific discoveries and innovation. So a little bit in terms of how this could happen. And we have a couple of examples, and due to the lack of time, I'll go through some of the examples in the next slide, which will just set the tone. So educational delivery. So highly innovative. I'll just like to draw your attention for some of the aspects that we believe can become part of the way education is done in dentistry and health professions. So think about remote learning in combination with virtual reality, machine learning, and artificial intelligence. So this has become then predominant and highly effective at both delivering and testing knowledge, with positive outcome measurements in terms of greater and more productive interaction among students, like I mentioned before, and student and faculty. In terms of the healthcare systems, we have now examples that our dental schools, this day and age, have adapted and become models of patient-centered, collaborative care, and offering the most advanced and efficient evidence-based oral health care available, which in turn promoted a more diverse community, stimulating an inclusive environment in patient care delivery. Another key aspect we believe in the delivery of education and assessment. So the implementation finally of interdisciplinary competencies driven by individual patient needs. And lastly, but also of significant importance, the scientific research and scholarship greatly benefit from the pandemic. So examples that resources coming now from the industry, from private corporations, have accelerated the delivery of scientific discoveries that helps in the promotion of oral care. So I think I'll stop there, and hopefully we'll have some great discussions in the next in the next minutes. So thank you.
Thank you, Dr. Patino. So let me remind you where you are in terms of the scenarios, and if you, Alicia can send the link again just to make sure that you have it. If you have the handout, I urge you to, for example, look at page 3, because page 3 is going to show you the juxtaposition of these two scenarios. Scenario 1, strengthened financial position, but not innovative in terms of the educational delivery, not low on educational innovation. The scenario you've just heard about, scenario 4, a very weakened financial position, but highly innovative in terms of education. So we're juxtaposing these two. If you look at that handout, page 3, that will give you sort of a visual of what you're discussing in the breakout. That handout also includes the scenarios page by page in order, scenario 1 through 5. If you have not had a chance to glance at that, you may want to do that, because that one pager describes again some of the highlights in each one of the scenarios. We do not have a lot of time for the breakout, so we're going to ask you to take 10 minutes to discuss each scenario. 10 minutes for 1, 10 minutes for 4. And 2 basic questions: what are the threats and opportunities within this scenario? Now, I don't want you to think strictly with your strategic planning hat on. I mean, if you strictly, people often think of threats and opportunities as coming from the outside. In this case, I just want you to think about threats in terms of what can harm dental education within this particular scenario. Opportunities, what's there? What are the advantages? What are ways that this scenario could advance dental education? So think, what are the threats? What are the opportunities? And then what are your recommendations to either actualize this scenario or avoid it? You might have recommendations for actualizing particular pieces of the scenario. So I've asked the fellows to help facilitate these conversations, and they're also going to be taking notes. I should warn this year's class, as soon as we put you into these groups, you're going to be in randomized breakouts. Felicia and I are going to look and try to make sure that Leadership Institute fellows are spread across the various breakouts. So somebody might just suddenly appear in your breakout room within 30 seconds, and then maybe a person will disappear. We'll see. But we want to try to get fellows in each one of the groups. So we're going to give you about 20 minutes for this. We'll bring you back at right around the top of the hour. I look forward I'll drop in on some of your discussions. I look forward to your discussions and hearing through the chat some of your ideas when we come back. So I hope you had a good conversation, and I hope you had enough time. It's difficult to, as you know, having done this as well for the last well, almost a year. Sometimes it's difficult to know when people are in breakout groups whether the timing is exactly right or not. But I hope you had enough time. I want to take a quick poll and ask you about the two scenarios that you just discussed, and ask you which one you think is most likely or more likely. Which scenario is more likely? The more things stay the same, the less they change. So there's money there, but not much innovation. Progressive and under-resourced. Not much money, but innovative. What do you think is most likely? People are still voting. I'll share the results with you in just a moment. If you could go ahead and finish your voting. Okay, I'm going to end the polling in about 5 seconds. Okay. So here's what you said. I mean, that 62% of you think that of the two, the more likely is to be innovative and educationally, but under-resourced. It's interesting that what, a little over a third of you did indicate that things might stay the same and there be increased financial resources. We had a lot of conversation about whether, is increased financial resources even believable these days. And when you look out 5 years, who knows? But I will say in the summer, if you think about the headlines in the summer in the Chronicle of Higher Education and other places, there were people who were predicting that as many as 200 or 250 liberal arts colleges would close by the end of the year. That has not happened. There have been some closures, but that has not happened. Dental schools and academic dental institutions, I am sure, are experiencing financial straits. That doesn't equate to having more money, but it's possible. I mean, it's possible that a new administration will put more money in higher education. It's possible, as I think was mentioned in one of the scenarios, that there's actually new sources of funding. This pandemic, for some, has actually generated revenue that could be shared with others in health professions, and particularly in health professions education. So I hope you had a good conversation. Let's move on to our next scenarios. So Dr. Haley, I will now turn to you for scenario 2.
Sounds good. Thank you, Carl.
I have your team up on the next slide.
Oh, perfect. We can go ahead to that. All right. So we were led by Dr. David Surratt from VCU. This is our team: Anna Ribeiro from University of Florida, myself, Afshin Lakhani from Boston University, Neeraj Panchal from University of Pennsylvania, Carmen Pfeiffer from OHSU, and Ethelyn Thomason from University of Colorado. So our scenario is stick with what we knew. So this is not probably the most exciting scenario, but in a lot of ways, it's maybe the most dangerous scenario. So we're dealing with a weakened financial position along with really minor changes to the educational status quo. So we can get into a little bit of the highlights if you want to go to the next slide. So these are just a couple of highlights to get everybody acquainted with the scenario. So a hallmark of the scenario is a weakened financial position. So, and on top of that, to make matters worse, the cost of dental education is definitely getting higher. So in absence of increased funding, increased educational costs, we have to find ways of bridging that gap. However, in lieu of pursuing new and diverse revenue streams, we increase tuition, we increase class size, we implement more international dentist programs, whatever we can to try to get more money through more traditional routes. While many of us have pivoted quite a bit during the pandemic in terms of our curriculum delivery, in this scenario, most of the innovative instructional methods kind of fade away and we return to a traditional and segmented 2+2 format, with the first 2 years being dedicated to preclinical and biomedical science instruction, last 2 years focusing on clinical care. There's very little horizontal and vertical integration, and we see primarily lecture style delivery of didactic content. As mentioned in the first bullet point, we have an increased class size and additional degree granting programs. So this puts a strain on schools' basic classroom and clinical infrastructure. Even with the strain increased, community clinic partnerships remain elusive, and we have too many students, too few faculty, too few chairs. So what we end up with is burnt out staff and faculty and a student body with a lack of experience compared to today's graduating dentists. And finally, we continue to see a lack of collaboration amongst departments, other dental schools, and other health professions. With the silos being maintained, we see little progress in terms of collaboration, integration, and resource sharing, both intra and interprofessionally. So how did we get here? I don't think the weakened financial position is a stretch of the imagination. Most dental schools are seeing a decrease in state support if you're public, and for both public and private schools, seeing a decrease in private giving. Dental education is getting more expensive with increased technology and supportive costs. And it may seem like a stretch that we would go back to the old paradigm of curriculum delivery, but the fact of the matter is that change is really hard for a lot of people. There are fewer barriers present for doing things the old way. Many schools and faculty may not see how to navigate the barriers of curricular innovation, how to increase collaboration within dental education and across other health professions, or how to create entirely new and more efficient ways of educating our students. After all, change is hard, and that's how we arrived at scenario 2, stick with what we know. With that, I'll turn it over to my colleague, Professor Bell, for an introduction to scenario 3.
Thank you. Hi there, I'm Katie Bell from Pacific University, and I have the privilege of presenting scenario 3. I'm going to start by introducing my team. I got to work with this fabulous group of people. So Sun Chung from University of Washington, Dan Given from University of Alabama, Sophia Khan from University of Colorado, Gildo Santos from Western University, and Stephanie Seitz from UT Health San Antonio. Next slide. So we had the enviable position, I think, of working in quadrant 3, which combined educational innovation with a strengthened financial position. So I think we really got the luck of the draw in terms of scenario planning. So if you'll go to the next slide, I'll cover the highlights for you. And so we approached this with the frame of what would the possibilities be if we could take everything we've learned about teaching with technology and doing it well, and all the bits of movement that we've seen for social equity that is starting to move, and our visions for what interprofessional practice could look like. What would it look like if we took all of that passion, drive, and dedication and supported it with sustained, adequate funding? Where would we end up? And so our scenario was really highlighted by collaboration and innovation. So what that would look like would be centralized research teams that are collaborative across, institutions, bringing people together to work on areas of interest with adequate funding. So increased quality and quantity of research. We imagined unprecedented curricular sharing, so capitalizing on using our nationally and internationally recognized content experts to deliver education to large numbers of students across the country. And what is probably our biggest envelope pusher, the development of the first virtual dental school. And what we imagine that looking like is a dental school in which students have all of their didactic learning electronically using technology and do all of their clinical training via a partnership between the virtual dental school and local dental clinics, dental service organizations, and federally qualified health centers, in which we had adjunct clinical faculty highly calibrated with faculty at our virtual dental school, which would decrease cost of attendance, increase access for non-traditional students, as well as providing additional patient care in the community and creating a pipeline for new clinicians upon graduation. I would say the overarching theme is that collaboration, innovation, and continued work on progress resulted in vast gains in diversity, equity, inclusion, and belonging, where we actually really see environments that are welcoming and bringing belonging to everyone involved. We would see a total transformation in interprofessional education, where the norm for dental education is to have clinical-based interprofessional education for all students, and a large increase in student, faculty, and staff well-being, with attention being paid to wellness programming. So go ahead and to the next slide. We had to wrestle with how could this happen a lot. So we even had to bring ourselves forward on how could this ever happen, because none of us were really able to imagine this easily. So potential funding sources that could make this quadrant possible include increased federal appropriations from the Biden administration, increased state appropriations for health education. One of the things we were thinking about is, in the wake of a pandemic, it might be reasonable to provide more money for health education so that we're prepared if this happens again. It could be that we see a social responsibility movement from companies that have actually profited during the pandemic. So tech companies like Zoom and Amazon, and also drug companies that have developed vaccines. It would be logical, I think, for them to invest back into society by investing in health education. Also, we might see an increase in private donations from alumni, friends of the university, and private industry to health education. Again, in the wake of a public health pandemic, that seems like a logical move for giving. So that is the broad strokes of our scenario. I'm going to turn it back over to Carl.
Great. Thank you, Professor Bell. All right, pardon me. So you know the drill. Same two questions. What are the threats and the opportunities within this scenario? You're going to spend about 10 minutes with one scenario, 10 minutes with the other. What are your recommendations, either to actualize the scenario or to avoid it? So we're going to send you away for another 20 minutes, and we'll send you a note, keep you apprised of the time. 10 minutes, scenario 2, scenario 3. Felicia, are we ready to send people off to the breakout rooms?
Yes, we are. Please join.
Welcome back. I hope you had a good conversation about 2 new scenarios. So I have a poll. This one's similar to the other one. I have actually a couple more polls for you. Let's see if I can get to it here. So you just talked about scenarios 2 and 3. Same question as before. Which of these 2 scenarios you think is more likely? Stick with what we know, scenario 2, or moving the needle for sustainable positive change. Scenario 2, low educational innovation, weakened financial position. Scenario 3, strengthened financial position, high educational innovation. Okay, I'm gonna close the polling in about 5 seconds. If you haven't voted, please do. All right, so we had 40 people, or 47%, saying that stick with what you know, sort of the status quo, but with a weakened financial position is more likely of the two. And let's see, 53% are very optimistic. Katie, you did a great job making the case about where the finances may come from. So I think that's a great I think vision of the future. If we have more financial resources and we actually can use them. I did have and you all talked about this, but I did hear some conversation in the group about this could happen, that there could be more financial resources, but yet there's some threats. The infrastructure may not support change that quick. There may be some threats to making that happen. But it's interesting that we sort of have this split on this particular comparison. So let me ask you now about all four scenarios to this point. So you've looked at four different scenarios. Here they are. Scenario one, the more things stay the same, the less they change. Two, stick with what you know. Three, moving the needle for sustainable positive change. And four, progressive and under-resourced. Of those four, which do you think is most likely? Which is most likely? Okay. I'm going to close the poll. And there are the results. So, and I'm jotting down these results. Significant number of you, look at this, think that progressive and under-resourced is going to be the future of dental education in 5 years. So not a lot of money, but doing innovative things educationally. Now I'm gonna ask you here just a second if you have some thoughts or comments before we take our break about any of these scenarios or about any of the things you've discussed this morning or we've covered this morning. If I'm going to watch the chat here, if anyone has anything that they would like to put into the chat, an observation, a question, just anything related to our scenario planning, things we've covered so far, maybe some things we've missed. Anyone? I'm not seeing anything in the chat. I'll give you another 30 seconds before we take our break. Five years, too short of a period to achieve the finances for scenario 3. Scenario 4 already in motion. Everyone wants progress, but the challenge is always having the resources to sustain it. Should look at the scenarios related to clinical education. Preaching to the choir, but progress will take strong leadership. Thank you. Underfunding is the same old. be forced to change because students are changing. However, at state schools, always heard that finances are tight regardless of the state of the economy. That's interesting. The state of the economy and tight finances. I remember I think it was in the year 2000, I was still an employee at ADEA, and I gave a presentation to the Business and Finance and Clinic Administration group. And it was, I think the title of it was assigned to me, but the best of times and the worst of times. And at that time, there were lots of institutions that were receiving just draconian state cuts to their budgets. So yeah, it was that was over 20 years ago, and finances were tight then, and people were alarmed then. Might be a pinch now. I'm just reading some of these selectively, but rewards in 5 years, scenario 4. Leadership strength and empowerment of the leaders qualified to lead in our profession. Need to remain tech savvy. Great. Look, thank you so much for your comments. We're going to take a break. We're almost well, let's see, 10 minutes ahead of time. I'm looking up at my assistant. 10 minutes ahead of time. We're going to take a break until 2 o'clock. When we come back at 2 o'clock, we will talk about scenario 5. Scenario 5 is, what if there's another pandemic? 5 years, where's dental education, academic dentistry going to be? I would suggest that as you take your break, you just mute your mic. It's already, for most of you, it's already muted. Turn off your camera. A few of you had some difficulty logging in for one reason or another. So now that you're in, you may not want to leave. So I'd just say, turn off your camera and your mic, and we'll see you back here in 10 minutes, top of the hour. Thanks. All right, Felicia, I will be back in a few minutes.
Okay.
And we will go to scenario 5. Give you a heads up on where we're going. So we're going to hear next about scenario 5. And then after scenario 5, and you discuss scenario 5, we'll all come back to our main room. And I'm going to ask each one of our steering committee members to give us a couple of things that they heard, maybe some key takeaways from the conversations that they've had or been a part of during the breakouts. Then we'll take some more comments from you and we'll wrap it up. We're scheduled to go to 3 o'clock. I think we'll probably finish a little early, but I'm going to turn it over to Dr. Yellick now. Now we're seeing like some light at the end of the tunnel. I mean, you know, soon, hopefully all of us will be vaccinated. I'm sure many of you already are, but what if it happens again? So let me get your slides up here. And Dr. Yellick, I'll turn it over to you.
Thank you so much, Carl. And good afternoon, everybody. Thank you for coming back after the break. So here I'll be presenting scenario 5 as a representative for my team, which is shown on the next slide. So we are the virtual synergists, and we are led by Dr. Nader Shahi, who's been our fearless mentor and leader throughout the whole past year. So we're very grateful to him. Our team consists of the following 6 people: Sherry Brownstein from Midwestern University, Kim Fennessy from Rutgers, Sean McLaren from the University of Rochester, the cold University of Rochester, Darini from University of Texas, Rick Walter from North Carolina at Chapel Hill, and myself from Tufts in Boston. And as Carl mentioned, described to you already, we were tasked with the scenario 5, which is supposed to be what will we do, or what we would be doing if there was a new pandemic that was discovered in 2026. And at first we were a little bit overwhelmed with trying to figure out how to do this, except we were also given the additional ammunition that it would be an optimal scenario.
Yes, 117 favorable.
I'm hearing an echo a little bit. Oh, an optimal scenario based on what we've learned. And so we kind of also figured out that this wasn't really too hard to imagine with all the new variants that were popping up all over the place, that it would be a very possible that 5 years from now we would be in a new pandemic. So on the next slide, it just kind of summarizes, if you've had a chance to read the extended one-pager, you've read more about it. But basically our scenario is based on the fact that in 2026, we're entrenched in a new pandemic. So similarly, it's a virus that's transmitted via respiratory droplets, similar to COVID-19. But now dental schools are in the front line, hand in hand, neck and neck with other healthcare providers to provide new and effective saliva-based testing and to administer these highly effective vaccinations. So based on all we've learned. And diversity, equity, and inclusion efforts have resulted in widespread access to treatment via dental schools, and also trust of these vulnerable populations based on this increased accessibility and education that's been provided by the dental healthcare professions. And so historically hesitant populations that were concerned about vaccinations are now in compliance along with the rest of the community, not just underserved communities. Everybody is kind of on board with the importance of compliance. And because of the recognized need and demand and importance of the dental profession for treating this and any other health concern, this pandemic, the dentistry has now reached really increased standing among other healthcare professionals and among their parent institutions. There's really a lot that dentistry is doing now. So what would this look like on the next slide? How would we implement this? Thanks. So how could this scenario happen? We're just kind of envisioning a situation where we have increased all the new technologies that we've learned. over the past year, and we will be learning in the next 4 years, is all being implemented. We have the latest technology, so even though it's a new pandemic, we can rapidly use mRNA vaccination, mRNA-based vaccinations to just quickly produce these vaccines, and distribute them, have compliance, just have really everything working very, very rapidly. In addition to having our healthcare profession able to work remotely, effectively, teledentistry is up and running. We have support from the state, from the nation to pursue these studies. We're kind of on an equal standing with the medical profession. So this is kind of what we're envisioning, even though it's not optimal that we have a new pandemic, we're going to be able to treat it very effectively.
Great, thank you. All right, so our third and final breakout, a conversation about scenario 5. So this, again, this, as Dr. Yellick said, this is an optimal case in terms of dentistry and academic dentistry's involvement with a new pandemic on the front lines. What are the threats and opportunities within this scenario? And then you've had this conversation before, what are your recommendations to either actualize it or to avoid it? We're giving you a little bit more time on this one, 15 minutes, just discussing this one scenario. Great. Well, thanks for still being with us. I was just sort of looking at the numbers, and we maintained a pretty steady number throughout the afternoon. So before we hear from our steering committee with some wrap ups, like some takeaways, things that they've heard from you in the discussion, let's just go back to chat again. And I'm very interested and would ask everyone to sort of read along with me at the comments. Any comments, observations about scenario 5? Scenario 5, this how you know, the way it's written is dentistry, academic dentistry, positioned in an optimal way for, unfortunately, another pandemic. Any observations?
I think in our group, some of the comments that were made right off the bat were basically the politicians are more of a problem than the academics are as far as moving forward. And that seems to be the root of what hinders us from making digital progress and progress in other ways as well in academia.
Great observation. Part constraints within the system. Other comments? I'm looking at the chat. I'll ask everyone else to look at the chat. Any comments or observations about positioning academic dentistry, oral health, dentists in the front lines in an optimal scenario, another pandemic? CODA need to continue to train dental students and dentists in testing and vaccination. Still need to continue communication with other healthcare partners. And keep dentistry and academic dentistry in the eyes of the government. Some might argue that this time dentistry and academic dentistry were not in the eyes of the government or others who missed the potential of dentistry and academic dentistry as a resource. Any other thoughts? One of the biggest challenges is going to be the clinical education of dental students in a pandemic situation. Yep. Collaborative research. Need to maintain the momentum in IPE. Focus on simulation technologies. We need to be working now to build our place as an indispensable asset. Yes, thank you. Universal policies throughout the country and dental schools regarding COVID policies. That's been an issue, hasn't it? New pandemic could be worse than this one if we don't take actions and take care of all the communities. Hopefully we can move away from patient-based clinical boards. Educate and convince students and residents to get vaccinated as we see charity begins at home. Only then can we get the larger population vaccinated. That's true, still not many are getting vaccinated. Show research outcomes that show poor outcomes with viral disease with a history of oral disease. To help make the case, we need to show how the industry improves overall health outcomes and reduce overall costs. Again, enhance and improve simulation technologies. Thank you. Any other thoughts? Need to continue the funding for an infrastructure that's planning for another pandemic. A threat is making sure we don't go back to how we were before the pandemic. Yeah. Never let a pandemic pass you by without learning something and capitalizing on that knowledge. It would be tragic if we didn't learn and make something of the difficulties of this past 12 months. All right, I'm going to ask our steering committee to give us a few takeaways from things that they heard in the breakouts. And steering committee, I think what I will do is just start with scenario 1 and work around the scenarios. So I'll start with you, Dr. Quick, and just ask, were there 2 or 3 takeaways from things that you heard? It could be about scenario 1, but if there are other takeaways that cut across the scenarios, please, we're just interested in what you heard.
Yeah, well, it's interesting how much of the conversations were similar and different, I think, in the breakout things. And so some of the things that I heard were, that we want to maintain personal connections with people regardless of what we do. So going to a totally, digital, virtual something, you do that. So there seemed to be sort of this desire for some sort of hybrid model. And also the acknowledgement that it's pretty easy to avoid change, if you're in a dire spot. So some of the challenges were like, how do we inspire faculty to get past fear-based decision-making and counterbalance that with fortitude? This is one of those things we were talking about, the sky is falling and everything's coming down around us, and in scenario 2. And I think everybody really wanted to be on the innovation track for the most part. And how do we move ourselves, possibly from scenario 4 to scenario 3 to do that? So that's my short version of what I heard. I heard a lot of other stuff, but I'm gonna leave it there so we can hear from other folks.
Great. Thank you. Dr. Haley.
Yeah, I agree with Dr. Quick. I heard a lot of the same things going forward. In this last group, had Dr. Andrew Spielman from NYU, who actually published a review article on the effects of pandemic in education. I hope that I got that right. But obviously they have a lot of negative effects, but historically they've had positive effects on education and innovation. So I think that's something positive as we move forward. One thing that came up in a couple different groups was that oftentimes the space of our 4 walls of a dental school limits how we can see the future. So if we look beyond that space, then think about what we can do. And that kind of goes back to your point earlier, Carl, about competency-based education. What if we had something that was progressive and personalized and adaptive in nature? How could that change what we do and how we are able to implement new curricula? And also, one thing that came up quite a bit was just the cost of dental education and how currently, if it keeps going the way it's going, there's a lot of DEA issues and inclusivity issues as it relates to getting minorities and marginalized individuals able to be dentists and experience dental education. So we really have to, that has to be on the forefront of our thoughts, is how to reduce the cost. Having a competency-based education could certainly do that. You wouldn't necessarily have a class of 2024. You would have, you know, people graduating at different times based off their skill level. So I thought that was really interesting because it came up more than once in different groups. But overall, I think the general trend from everyone that I spoke with was just a feeling of positivity and optimism going forward. So that's going to be my main takeaway, I think.
Great, great. Thank you. Thank you. Professor Bell.
We had some really excellent conversations, and I would say a lot of our breakout room conversations, I've heard similar things that Karen and Colin have shared. But the main takeaways that I'm going to share are that while the general sentiment seemed to be that while we had to shift to online and we did it and it was a little painful, we've also learned a lot about doing that well and how to be engaging and how to maximize that educational delivery online. We're going to need to intentionally take that forward and also really pay careful attention to balancing that distance delivery model if we are moving forward to sort of a blended version, like we've been chatting about today, with maintaining community, because a lot of us have observed that our students, we have more students struggling because they are not engaging in community the same way that they get that community sense when they're all together. And so being very attentive to doing what we can to maintain community and helping students in that vein, because a lot of students we've sort of seen aren't amazing at self-managing and being and taking the initiative to form that digital community. So moving ahead with a lens towards supporting students, faculty, and staff if we're in this sort of more digital environment. And the other thing I would say came up in a couple of conversations is working with students very intentionally during their clinical training on developing soft skills and patient rapport, some of the things we have less ability to do in a digital environment, or it doesn't come as naturally in the digital environment. But I would say overall the feelings have been hopeful. We've learned a lot. I think if we just stay focused and intentionally take it forward, we're going to be moving in a good direction. We can't stagnate and we can't go back.
Thank you. Thank you. Dr. Patino.
Thank you. Yeah, I echoed, all the three scenarios, steer members for the sum up. And I'll just add a couple of things, particularly related to the under-resourced position of the scenario 4. So we heard quite a lot of, continue to exercise philanthropy and continue to exercise collaborations with private companies, and how does that can really have a great impact moving forward, as we have learned through COVID, that this can be, a resource that can make a significant impact. So really diversify the portfolio where these monies will be coming from, and the overall advocacy also to the government and to funding agencies, federally funded, federal agencies. So I just touch, in a couple of these aspects from a financial standpoint, particularly related to delivering education and leveraging research and the outcomes of research in terms of helping and delivering oral care. So
Great, thank you. So moving beyond our 4 quadrants to the conversation we've just had, Dr. Yellick, scenario 5.
Yes, we had some really interesting conversations, and there were some key points that came out about it. One is that the interactions of the students, the interactions of the interprofessional students to deliver vaccines, et cetera, in some of the institutions like the University of Chicago, University of Illinois, Chicago, UIC, really was a wonderful opportunity for the students to get to know each other, for the students to appreciate each other. And I think, and we discussed how that sort of interactions is going to grow into the next generation where the health professionals are more interdependent and appreciative of one another as equals. And so that was a tremendous opportunity. Second is that maintaining many of the innovations that out of necessity were generated during this past pandemic should be maintained, including centralized communications. So many institutions, including my own, had at the beginning, people didn't know how to communicate effectively, and there was like nothing. And then everybody was kind of like putting their own input. So different deans felt like they weren't, saying enough, and it was, so everybody was getting multiple emails, and it was just very confusing. So, keeping a centralized and effective communication system really relieves a lot of anxiety among everybody and really makes things happen together. So that was important. And the other is the importance of top-down support. So getting the University Chancellor of Health Affairs, or our deans, or the president, provost's offices to, push these efforts for collaborative treatments of a pandemic or any other efforts is really where it has to come from, because they hold the purse strings. They're the ones that are drivers of this. And the last point is just to maintain all the innovations that have been generated out of necessity again. So how are we going to use these innovations and keep them in place such that everything is ready if we do need them in the future, which we probably will.
Great, thank you. And thanks to all the steering committee. So let me just make a couple of other quick announcements before we dismiss. Felicia has sent a link to the slides. So if you wish to download those slides, please follow that link and you can get the slides from today. She has also sent a link to the evaluation. So please complete the evaluation about today's program. I want to thank Felicia for helping me out. We've been helping each other, although we tend to have more problems when I'm helping Felicia rather than when she's helping me. But I'm grateful. We've been helping each other out since this pandemic started with Zoom. And so she's been working behind the scenes, making sure everything runs smoothly. And I'm grateful for that. If you were at the commencement last night, Felicia has been very involved in this year's Leadership Institute. She'll be more involved in the next class. I want to thank our fellows for all the hard work they have done on the scenarios. And they had the commencement last night, but they probably know there's still a little more work to do on the scenario. So that's coming, but I'm grateful for all the work that you did. The scenarios, just like this year, the scenarios were an experiment, right? We'd never had that kind of project before, never done a virtual Leadership Institute. I want to thank the steering committee because of all their hard work in shepherding this and overseeing the process. And then I want to thank you for being here and being a part of our discussion today. That if you remember, when we think about those 6 steps we followed, that sixth step was gathering feedback from other stakeholders. And you may have noticed, but if you had a fellow in your breakout groups, they were taking notes. Those notes will help inform the next versions of the scenarios. So with that, again, thanks for your participation. I hope you stay safe and well and enjoy the rest of the ADEA annual session. Bye-bye.